Dr. Eric, the fitness physician. I'm all about hormonal fitness and muscle medicine and continuing on my Thyroid Thursdays. I'm going to start branching off too and doing thyroid and metabolism Thursdays because there's a lot of other topics that lend into itself or lends into this. Other metabolic issues, insulin and cortisol issues, PCOS, all these other issues as well. But going to continue on real quick today about thyroid. Someone was asking me about this and we're talking about supplements, right? We always talk about supplements, which ones are good, which ones are bad. So there's a couple of supplements that you may not necessarily have to avoid, but you have to time just right when you're taking thyroid hormones, right? So that's what we're going to talk about today. And I won't delve into this too deeply, but I just want to touch on this because some of these are very, very common. So some of the big ones are things like iron and calcium, okay? Obviously, we want people taking that if needed. Certainly, iron is often low in a lot of people, especially women, and we actually do have to have optimal iron levels and ferritin levels, etc., for proper thyroid function. If they are low and you're having symptoms, that could be an issue and that could be the source of the problem. So I like my patients to have a ferritin level in the optimal range, typically 60 to 80, sometimes closer to 100 depending on the patient. Same with overall iron levels. So they are beneficial and helpful and can be detrimental when too low. Of course, they can be too high, especially sometimes with men, but it's something, again, just to watch. However, if you are taking an iron supplement, similar to calcium, again, a lot of people need extra calcium, but if you're taking these, you don't want to take these around the time of your thyroid. I tell everybody to take their thyroid hormone in the morning on an empty stomach and not to eat or drink anything for at least half an hour, preferably an hour. And even water, just a little sip as possible to maximize absorption. Basically, iron and calcium are combined. They can bind up that thyroid hormone and prevent it from assimilating and being absorbed into your body. So you don't want that. If you're taking it, you want it to work. So wait at least 4 hours or so, 4 to 5 hours before you take this. So maybe this is something you take in the evening. Biotin. Some people take biotin for their hair or skin, etc. Mostly the hair, but sometimes it's found in multivitamins and other vitamins. You have to look and research it and see if you actually have it or not. Not that biotin's a bad thing, but it can falsely elevate your thyroid levels on a test. So if you get your lab work done, your levels can look higher than what they really are. So just skip it that day or the day before if you're getting your lab work done. Not a big deal. PPIs or proton pump inhibitors, acid blockers, things like Pepcid and Zantac, etc. Similar thing, they can disrupt your gut microbiome if taken chronically, and they can also interfere with absorption of your thyroid hormone and other hormones as well. So something you want to take either not at the same time of the day for sure. Obviously, a lot of people, these are really meant to be more short term. It's best to not be on these chronically because it can disrupt the microbiome, affect bone metabolism, many other things I'll talk about at another time. Similar to iron and calcium is fiber, right? Fiber, of course, we all need fiber. We all promote lots of fiber, but again, it can just bind things up and absorb all your hormones that you're taking. So making sure, again, you're eating plenty of fiber, but again, maybe avoid it the first few hours in the morning after you take it, or at least wait a couple hours and have a little bit and try to increase your fiber intake at lunch and dinner, again, to decrease thyroid absorption. Thyroid glandulars. Some people will be on glandulars. I put a lot of patients on adrenal support. Sometimes those have adrenal glandulars. There's some thyroid supplements that have thyroid glandulars, which are totally fine, but you just want to make sure that it's a good quality brand that actually doesn't have thyroid hormone in it. Some of them actually do. And how do you know? You don't know unless you actually research it and call the company or do a little digging on it. But it's not a very common supplement that too many people are on. Every now and then I'll see someone who's taking a thyroid glandular. And again, if it's just a glandular support product, has some or certain vitamins and minerals in it, that's totally fine. But if you don't want actually active hormone in there, so it's just something to be cautious of. And again, if you're monitoring your symptoms in your lab work, it's going to be okay anyway, but just something to be cognizant of. Last one is estradiol or estrogens. Obviously, I have a lot of women taking estradiol therapy, and of course, massive benefits, but it can affect your binding globulins in your blood, which can soak up that thyroid and affect your levels. And again, I've not seen this happen too many times, but again, it's just something to watch. Sometimes you may have to make some dose adjustments on your thyroid hormone if you're taking, especially if you're taking bigger dose of estradiol. So these are just some things. Again, it's all about timing and getting those dominoes in line. Like I said, it's a complicated milieu, and this is just touching the iceberg. So we're gonna talk more in the future. So like this, share this, tag me, tag this post, share with people that you know who need thyroid support. Or on thyroid supplements or anything like that in general. Reach out to me. Let me know what you wanted me to talk about, and I will talk about anything related to hormone optimization, health optimization, longevity, and much, much more. Everyone have an awesome day. We'll talk to you soon. Bye.